Okay, we're going to go back to Bay Area Hospital. Bay Area Hospital is a large employer and provides family wages and services to the community. Why wouldn't investments to save Bay Area Hospital be a better return on investment versus the container port?
Well, a container port will bring money in, a lot of money in. You know, the facility would be taxed. The people that come to work here will be paying taxes. And I think you have to have something that's going to be sustainable to fix the hospital. You say, give money to them, or you give a lot of money to them. What do they need, 24 million or something to get out of debt? Well, you haven't fixed the problem by giving them $24 million. You just made it so that they can move ahead. But until you fix their revenue problem, I think it's going to be difficult. We need to increase our family wage jobs and our tax revenues. And a lot of our problems will go away. So I don't know that that is a question that should we do either. You can't. I just don't know how you're going to get enough people donate enough money to keep the hospital afloat unless there's changes.
Unless there's changes?
Unless there's changes, I hope, yeah, I'm sure we can keep it afloat.
Many of our current family wage jobs are at the hospital. If it closes, we will lose those jobs. How can the county or state help keep that from happening?
The state could give us some money, but they don't have a lot of money anymore. I know the county doesn't have any money to give to the hospital. We could close down the jail. That wouldn't be very good, but we could. And that still wouldn't help the hospital. It wouldn't be what they need. And sometimes choices like that, it's hard to address those questions. Because the same people who are going to be building a terminal are not interested in building a hospital. And or they're not going to give us money. Now if they come here, there'll be a lot more money available for the hospital because of the wages. But I don't think it's one or the other.
Well, in my mind, I'm going to speak up here. The hospital is going to benefit from the port in one way. There will be people coming there to the emergency room, and they need that hospital in order to serve those workers that may need emergency services.
Yeah, well, hopefully they'll come to the hospital for all kinds of reasons.
Absolutely.
They get sick like we do. And so, yeah, I hope they don't come just for emergency services.
Please use
Will the county commissioners advocate in Salem for the items that the hospital is asking for? The $10 million in emergency cash infusion, and I think they're asking actually OHA for that. And help with debt refinancing, an increase in Medicaid reimbursements to 150% to cover costs, and in 2026 the use of lottery funds to help eliminate the loan debt. And so I would ask if the commissioners are willing to advocate for that at the state level.
Now, where were they when we needed relief? We worked our way through it ourselves. We didn't ask the hospital or the city to come to our rescue. We have limited input into the state. Certainly, individual commissioners can talk to individual legislators, and we will, to encourage them or tell them how important that hospital is to us. Our biggest lobbying power is through the Association of Oregon Counties. And they kind of deal with problems that are widespread. And so perhaps that would be a way that we could lobby for the state to help hospitals in rural areas, because this is a problem not unique to Coos County.
Okay, I have another question from the audience. How will goods get transported to the valley? Our railroad will not support the proposed double-stacked containers. Railroad will have to be rebuilt, and bridges. Oops. Tunnels will not support these containers. Cost to rebuild, length of time to get this done. Could Coos Terminal compete with LA and Long Beach?
Well, part of the funding for this, whether it be private funding or federal or governmental funding, largely fed and state. And again, I think building infrastructure is a legitimate public responsibility. These projects are too big for all but, one would think that. Now we have corporations that are flying for the things in the sky all the time. But typically, infrastructure of the magnitude of what's going on here is dependent upon public financing. Privately, the dock and the terminal, I understand, is being funded privately. That's appropriate. Can we compete with Los Angeles and Oakland and Seattle? I was in the shipping industry for 38 years. I worked for Sauce Brothers. I went to all those ports often. And what I would generally see, particularly in LA, Long Beach, was ships lined up waiting to be unloaded. That's really, really, really expensive. You don't just tie a ship up and let it sit around doing nothing. That adds a lot to the cost of bringing goods into the United States. And in Los Angeles, you have containers that are going to be used in the Southern California metropolitan area that are competing with containers that have to go all the way across the United States, competing for berth space, competing for railroad space, competing for whatever. Here, there won't be. This is dedicated to put those containers right on a car and ship it to the middle of the United States. It'll take a lot of pressure off of congestion in Los Angeles and Long Beach, Oakland. Ever tried getting through Portland and on into Seattle in a reasonable day? You know, so much that's become metropolitan area that it takes you forever. And anything we can do to reduce the congestion around those huge metropolitan areas, I think is good. And it would serve the people of the United States. We need money coming in from other places. We don't need more places just to spend money here until it wears out.
Okay, so I'm going to go on with some of the questions the league had. The formulas for distributing funds around the state are typically based on population numbers. Would you support changing the formula in some cases to the percentage of population affected by the problem being addressed?
Well, I'm trying to think of things. The state gives us money to fund our our county's mental health capacity and our public health capacity. And certainly we get less money than Eugene gets. So the answer is yes, the state does that. We get less money for roads, for county roads, than other places. And that's based more on mileage of roads, but that kind of comes with the people. The more people they have, generally, the more miles of roads. I kind of think that's already done. There may be a specific example that would allow me to give a better answer, but off the top of my head, I think that's kind of the way it works.
So-
You don't think so? Tell me.
I think the example, John, that people might look at is, for example, mental health funds. We're a small county, but what percentage of our population of 60,000 need mental health services versus if you take just a flat formula and say Coos County has 60,000 people and base it on the population. But if a third of our population needs a specific service and somebody else only has 5%, they got a really healthy population. I think that's where they would go.
I see. Yeah, I don't know how down in the weeds the state gets in counting the number of people with particular diseases when they allocate, or medical issues when they allocate money. But it does come back in most instances to the population. And I guess I really don't. I know our parole and probation department, it gets, it's all based on head count. How many people are they serving? And they get funding for that. But I think we, by and large, get more money than smaller counties do and less money than bigger counties than we do. They may not get down to the point how many people have this disease versus some other disease.
So please talk to us about the impact of last year's changes in the drug laws and how have they affected law enforcement and the courts, and are the allocated funds adequate to meet the needs at the local level?
No is the answer to the last.
That's kind of the same thing.
You may recall when, now let me go back. When they legalized marijuana, they said some of those funds were going to go to the county for their law enforcement and drug treatment problems. But then the state came in and said, we're going to create drug rehab facilities around the state. And so we're going to take some of that money that we've been giving to the county, and they took a lot of it. But they never got those facilities built. And so nothing happened. And we ended up with less money. We still get some. But drugs are a horrible, horrible problem. You should see the way some of these houses, or what people live in, and what their children live in. We need to clamp down on drugs. We know from our experience at parole and probation, we call it Coos Community Correction, that if you don't have a stick to enforce the terms of parole and probation, they don't show up. So let's say you're a drug addict, you choose not to go to your parole and probation session, you choose not to go to your drug rehab meetings, and you choose to hang around with your same old friends and have some drugs now and then. There are no consequences. What we used to do was put them in jail. They didn't like that. Not because they didn't mind jail, they got fed, it was dry, but they didn't get their drugs. But now, if you're put on parole, number one, you aren't going to get arrested for just having drugs, even though they're not legal. We have enough people to arrest the murderers and the rapists. But if you don't do something pretty serious, you won't get arrested. And if you do, you won't get prosecuted because we don't have enough DA staff. And if you do, nothing will happen because we don't have any jail capacity. So, in a way, it comes back to revenues, and revenues coming back to better jobs and more jobs. We have lots of people here who aren't working, but you can't get them to work, and if you do, they don't show up the next day anyway. So, not an easy problem. There are answers, but they're not easy. And there's going to be trade-offs in these answers. There's going to be more people, be louder. Bad enough already, you can't get across the street to get to the bar. Just so, anyway, we need new investment. And again, new investment that brings people in, or brings money in. Not new investments in more shops and stuff that just circulate the money that's already here.
Okay, so there are concerns about the fatalities and accidents at the Powers 42 junction. Are there any plans to fix that problem area?
Well, it won't be the county that does it because it's a state highway. And the state is has spent a lot of money fixing up 42 from here to Coquille, largely in making better culverts for salmon passage. But they've also are doing things for the safety of the road. And if that's identified as a problem, and if they can identify an answer, I'm sure they will get to it. I don't think it would happen right away, because they are not able to move that fast. They have a whole line of things they have to take care of.
Thank you. So the transient occupancy tax is an important source of revenue for many communities in Coos County, but it is saddled with the 70-30 formula that requires cities to spend 70% of all revenues received from that transient occupancy tax on tourism promotion and facilities, not things like infrastructure improvements that facilitate further development. Would you consider advocating in Salem for a change in that formula?
Well, I have already. Yeah, I think there's it needs to be looked at. Not tourism. We're a little bit buffered here. We don't think we are, but we are a bit buffered. But you go up into northern counties, Tillamook, Clatsop, they are absolutely overwhelmed during the summer months, and they get, I can't remember the numbers, but their population triples or doubles, something like that, and it requires a lot more patrol, which they don't have the funds for. And to me, that would be a legitimate use of transit lodging tax funds. I don't think you should use them for, a lot of things you shouldn't use them for, but for that, you should, yeah, I think that would be legitimate.
Thank you. So how will the changes in federal funding that are coming down affect the state budget and state's government ability to provide services to county and local jurisdictions?
Well, yeah, every time you turn around, there's something coming down, but it doesn't always stay. People change their minds quite a bit, apparently. But yeah, it will. I mean, our entire public health, mental health department is, the money comes to us from the state, but it's money the state gets from the federal government. So you change these programs, reduce the programs, it'll eventually get us here. We, at the county, we haven't lost a lot of money because of federal cutbacks yet.
Yet. Okay, I think that's it for the program. I thank everybody, unless there's any other questions from the audience. Thank you, John. We appreciate it.